put together a short video to help guide nurse practitioners, doctors, about how to have that conversation with families, how to approach this topic of genetic testing for a child with some form of developmental disability. So the first thing I would recommend doing when you're preparing for this conversation with families is to really set the tone for the conversation. Sit down with them, be on their level physically. Many families will say that they have been intimidated or even felt like maybe their doctor was rushing the conversation if the doctor was standing up. It just leads to a bit of a different feel for the conversation. Make sure to talk slowly. A lot of times families have difficulty understanding the complexities of genetic testing, so it is important to talk slowly. Let them know you have a very important topic to discuss with them. This is new information and it may be relevant for the test that will be ordered, ultimately to guide the child's care. So this really lets the family know this is a different topic, this is not something routine, and it helps them to get in that right mindset and pay attention maybe in a bit of a different way. I would also certainly recommend telling the families up front that this information about genetic testing is complicated and can be confusing for them. It's complicated and confusing for many families as well as healthcare providers. And if you tell the family this up front and then later they do find themselves being confused, you've just normalized things for them a little bit. You've validated things, and then they don't feel quite so bad or quite so behind if it's taking them a minute. It also opens the door to let them ask you questions. If they don't get it the first time around, they can say, "Let's try that again. Can you explain that to me one more time?" When talking with parents about genetic testing for their child, I would really recommend using both visual images as well as analogies. There are many types of adult learning styles, and when images are used, it can really help individuals better grasp concepts. That is regardless of a parent's educational background. It just really helps anyone to have pictures. Many different genetic testing laboratories, including Lineagen, have created a set of simplistic files, we call ours the Genetic Counseling Flipbook, that really brings these images to life, that shows the doctor, the family, what these genetic components are. You're welcome to contact Lineagen and receive our Genetic Counseling Flipbook to aid in these discussions. Now, the analogies can be quite helpful as well, and I'd like to share one that is classically used by genetic counselors. I will often talk with families about the genetic code similar to the way I would talk about a recipe for making cookies. So, for example, you might sit down with the family and say, "We're going to look at your child's genetic code." I think of one's genetic code like a recipe for baking cookies. We need to know how many cups of flour, how many cups of sugar, how many eggs, how long to bake the cookies for. These are all important things in the creation of this batch of cookies. If someone is following that recipe and changes are made while they're baking those cookies, the outcome might be different. This could be a subtle difference, or it could be one with more of an impact. For example, you might use dark chocolate chip cookies instead of milk chocolate chip cookies. Well, the same effect is going to be there. That won't lead to a very drastic change. But maybe the person following the recipe forgets to add eggs. That could lead to a very different outcome. This gives the family a bit of an idea, a framework for thinking about the genetic code, and everyone understands what it means to follow a recipe. So after you've established that sort of analogy with them, you can transition and say, looking at the genetic code would be like following this recipe. We're going to look at the genetic code and see if it matches the original instructions for the child. There could be a difference there. And if there's a difference in your child's genetic code based on what the standard genetic code should say, we might expect some differences. Those differences can be very subtle, or they could have a big medical impact for your child. For example, those changes could alter the physical development of the child. Maybe there are birth defects present. It could alter the development of the child from a learning or cognitive perspective, or perhaps both. So after you've talked to the family about this analogy, you've kind of set them up to understand what the genetic testing will do. It's really important to tell them what specific concerns you have about their child, if that hasn't already come up in the conversation. So for example, you could say, Mr. and Mrs. White, we notice that your child has a delay in his development. He's not walking, and many children his same age, even children younger than him, are already walking. We are also concerned about the potential for autism spectrum disorder. That's based on his struggles with communication and his more rigid play habits and lack of imagination. It's important to just put it out there on the table, be specific, make sure the family really understands what those concerns are, and then you can bring it back to that genetic testing. So these alterations in your child's development could be the result of some change in his genetic code. Was there an alteration in his development? And most importantly, it seems trivial, but parents really need to hear that if a genetic diagnosis is found, it is not their fault. There's nothing they did or could have done differently to prevent a genetic change from happening. No one has control over the genes they pass on to a child and what happens to those genes. I've found myself over the years telling parents that, and it's amazing to hear their responses. They'll say things like, I know that has to be the case, but hearing someone else say it really makes me feel better. And I'm an educated person. I understand that I can't control my child's genetic code, but thank you for saying that. So it really is important to make sure they know it's not their fault. So I hope this information has been helpful to guide you as you approach these families about genetic testing. And please remember that you're welcome to call us and request a copy of that genetic counseling flipbook. And if you need more information, you're always welcome to call Lineagen's team of genetic counselors who are available to answer your questions about clinical genetic testing.